Hello, good afternoon. This is Dr. Rodriguez Mias, and first of all, I would like to thank the committee for accepting our study to be presented here today in this special ICES Congress. So I would like to go ahead and present our study titled Pelvic Floor 3D 4D Ultrasound in Women with Double Mid-Urethral Sling, TVT after TOT. No disclosures, neither fundings have to be declared. So the hypothesis of our study is to examine the double sling position by pelvic floor ultrasound and cure rate in patients who have received a retropubic suburethral sling after a transoburator tape failure. The study, its design, is an observational study involving patients with recurrent stress urinary incontinence treated in a tertiary university European hospital between January 2006 and December 2009. All women included have received a TVT procedure secondarily after a TOT failure. Medical and surgical background of each patient were collected besides data related to the surgery. So based on the perineal ultrasound, the position of the sling was described relative to the bladder neck and the lower margin of the pubic symphysis at rest and on Valsalva, as well as the angle formed by the arms of the sling tape as Rodriguez describes. So this study was registered and has received institutional review board approval in our institutional review board. In the results, we have obtained that 14 patients out of 23 have received a double sling where have been studied by pelvic floor ultrasound to evaluate the double sling position. In total, 85 of our patients were postmenopause, 78% of them they were multiparous, and in 57% of the TVT placed, they were placed due to a stress urinary incontinence, while 42% it was placed because of a mixed urinary incontinence. Only 40% of TOT has been needed to be excited previous to the second anti-incontinence surgery. So the median follow-up has been 106 months. 35% of them they are currently cured, another 35% they refer to be much better, and only 28% of them they say that they are not cured because of a urge or mixed urinary incontinence. Only one patient during the surgery had to have the TVT removed due to a complication immediately after the surgery. No other complications have been shown during the follow-up. So the ultrasound results show a post-void residual volume of 31 and a detrusor wall of 3 millimeters. The mean urethral length has been to 29 millimeters and the bladder neck descent was 7.8 millimeters. The yatal area, if relaxed, Valsalva or contraction, was 16, 19, and 14 respectively. So 40% of them had a levator muscle avulsion, while none of them had an external or internal anal sphincter damage. Comparative data scan between measures are shown in this table. So as you can see in the table, sling distance to the urethral lumen is statistically different between TOT and TVT, both in relaxed and Valsalva, as well as the angle between two meshes arms. So failed cases do not show any ultrasound differences compared to the cured ones. To our knowledge, this is the first time to report ultrasound results correlated to clinical outcomes in patients who have received double anti-incontinence mesh. According to our data, we accept that TVT is effective to treat recurrent stress urinary incontinence after TOT failure, while the pelvic floor ultrasound shows some differences in some parameters between the two sling positions. In conclusion, we can say that the use of pelvic floor ultrasound might help the surgeon to understand the reason of failure sling in complex urinary incontinence cases. So thank you very much for your attention. Let me know if you have any questions. Have a great rest of your day.